We are going to connect with Dr. Noah Ivers, a family physician at the Women's College Hospital in Toronto. Thanks for joining us, Dr. Ivers.
It's my great pleasure to be here.
And you're also a Canada Research Chair in the implementation of evidence-based practice. I should have mentioned that as well. But let's get into this vaccine. The Moderna vaccine, how does it compare to the Pfizer BioNTech? What are the similarities? What are the differences?
Thanks, Jacqueline. I'm getting questions from my patients all the time about the vaccines, and it's a great opportunity to try to explain some of what we know to both them and all of Canadians. I think these are very similar technologies, these two vaccines. They both use the mRNA technology. That's a technology that's been around over 10 years. But of course, this is the first time we've used it for a large-scale vaccination program. The great advantage of that technology is exactly what we're seeing now, in that it can be adapted, and a vaccine using that technology can be produced very, very quickly. And that's why we're able to see these running through, between the two studies, over 70,000 people have been in the trials testing these mRNA vaccines from these two different companies. We've had no serious adverse events in either of those trials, which is really quite remarkable, 70,000 people. And we see similar effectiveness across these two products from these two companies using this same technology, in and around 95% effective, which is as effective as we see pretty much of any vaccine for any condition.
And David Cochran was just mentioning the age limitations on this. So the approval of this vaccine is based on it being given to adults aged 18 years or older. The Pfizer BioNTech approval was for 16 and older. I'm curious just what you make of those limitations, I guess, based on the fact that those are the people who tried the virus in these trials, right?
Jacqueline, these are the people that were invited to be part of the experiment, where they did the research to understand how well the vaccine works and what its safety is. So what we don't know is, we don't have information on people that weren't in those experiments yet. And that's why both of these companies are making headway to do trials in younger people. So that we can speak honestly, based on really good data, what is the effectiveness and safety in children. What we can say right now is only what we have data based on, and we have data based on adults.
Right. And the effectiveness of this vaccine is also based on those adults being willing to take the vaccine. And I know that's something that you have talked about in the past. So how confident are you that Canadians will be confident in both of these vaccines, the Pfizer BioNTech and now the Moderna?
Thanks, Jacqueline, for raising that. Just as we have never been in a situation like this in our lifetime, where our worlds were changed, where we can't hug our loved ones, where we're seeing people dying alone in the hospital. We've also never had to make a vaccine this quickly. And I think that understandably makes people have concerns about whether corners were cut. I'm here to tell people with certainty that no corners have been cut in Health Canada's process of reviewing the data. These two companies in particular were able to recruit, as I said before, 70,000 participants for the trial. They were able to do that because there is so many people out there with coronavirus. And they made a great sacrifice being willing to step forward and contribute to science. Now we have the benefit of their sacrifice. We know what the results are, and we can say with quite a lot of certainty that this is a safe and effective vaccine. Yet still, people have reason maybe not to trust, historical and contextual reasons to worry about what's being offered to them. And I want to let folks know that, myself and a coalition of 300 plus professionals from various disciplines are working with government and working with communities to understand people's concerns. This coalition is called 19 to 0. we want to understand people's concerns and try to address them best we can, so that people can place their trust honestly in this vaccine. The reality is that only if all Canadians step up and get themselves vaccinated are we going to end this pandemic. The faster we can do that, the better. I'm desperate to have my parents be able to hug my kids again. And the only way we do that is to get to herd immunity through vaccination.
We will keep digging into the details and the facts here on CBC News Network. Thanks so much for joining us, Dr. Ivers.
My great pleasure, Jacqueline.
That's Dr. Noah Ivers in Toronto.